If your nose gets sliced off.
New spots for noses, be careful of chainsaws, and could you actually survive being inflated like a balloon? Today, we're back breaking down and reacting to all the heart-pumping medical scenes and wild injuries from the highly successful animator Zack D Films. Let's dive right in.
If your nose gets sliced off.
Getting your nose chopped off. You could have bone that goes with it, but most of the time this part of your nose just has cartilage versus the bone at your bridge. It is open, so you might actually have like a prosthesis there temporarily.
Doctors can place tissue expanders under the skin of your forehead. Once it is stretched out enough, they'll shape it into a nose. Then they take some cartilage from your rib cage and craft it into an internal structure.
Tissue expanders, usually it's almost like expanded by air, like a balloon underneath the tissue, a device that's put under there. You slowly stretch the skin because it does hurt. There's increased pressure there. Is it going to be unsightly? Yeah, potentially.
Which is then placed under your new forehead nose. Over several months, the new nose will take shape and develop necessary vessels. It's then removed from your forehead and surgically transplanted onto your face.
Growing the nose on the forehead is actually a technique plastic surgeons do. It's called a forehead flap. You do run the risk of that tissue not having good blood supply when you reattach it, and you can have it become ischemic and necrose and turn black and then not take. That is a risk.
If you somehow removed all the blood vessels in your body and tied them together, you might think it would be about this long.
Longer, much longer.
It has thousands of these tiny vessels.
You can see your veins and your arteries and these big vessels, but we have small little ones everywhere. The venules and the arterioles and even capillary beds.
With all of them combined, it would go on to reach all the way across the Pacific Ocean. Not only would it make it all the way back to your starting point, but it would be able to make this trip 2 to 4 times over.
Wow, how amazing is that? Your arteries, your veins, the capillaries, all the sizes in between make up your cardiovascular system because your heart's involved in that. But then you have your other systems that are other highways like your nerves or your lymphatics.
If the rotating chain of the bar hits something solid, the chainsaw can suddenly kick back toward the operator.
As an ER doctor, I've seen this more than a few times. Haven't seen any complete amputations, but seen partial amputations from chainsaws and massive destruction of tissue because it's a chain that rips.
Now, unfortunately, this usually happens in the face or neck region.
Yep. We're always talking about zone 2 of the neck. Major blood vessels to this area only covered by some simple skin and muscles. You got all those funny lines, and then you got the sternocleidomastoid, you got your scalene muscles. They're there to protect and help with movements of the neck, but they're also there to protect the major structures underneath.
If you lose your thumb and it's not able to be reattached, you'd probably think you'd be thumbless for the rest of your life. But that might not be true.
A lot of times when we amputate fingers, they're actually not able to be reattached. Most of the amputations that we do see are usually at the distal phalanx, so there's less blood supply, smaller structures, harder to reattach. But you try to reattach it if you can.
You see, a doctor can actually take your toe from your foot and meticulously graft it onto your hand.
Has anybody had this done to them, or do you know anybody who has any toes as fingers? Let me know in the comments.
Once it adapts and heals, the toe functions almost exactly like a thumb, giving grip and dexterity.
If you lose a finger, get bleeding control, then get the digit that is now amputated off, maybe wrap it in gauze, and you want to put it in a cold water ice bath, but not directly on ice, and bring it with you to the hospital.
He burned his initials onto the liver with a high-powered laser. Then he sewed up the patient and acted like nothing had happened.
Before you have a surgery, you might take a marker and mark like left side, right side, what area is going to be removed. Patient sign it and the surgeon sign it. That way everybody knows where you're operating so you don't have that error. But branding a person's organ, you're ruining or injuring an organ. That is awful.
Hey, that's awful.
The new liver started to fail. The patient went back in, but this time she was treated by a different doctor, and he soon found the initials inside. He eventually lost his medical license.
Wow. The liver can regenerate from injury. If there's not enough healthy liver, it may not be able to regenerate enough. There are other surgeries that you can do to block blood supply to one side of the liver that might be damaged, and it forces the other healthy side of the liver to grow a little bit more to take over.
If you lose your hand...
Whoa. Super cool just imaging wise. We're missing some underlying tissue, but you're seeing vessels. You're seeing the bones of your forearm, not the bones of your wrist.
If your blood vessels and nerves are in good shape, you might have another option. You see, a doctor can take a hand from a donor and meticulously connect the bones, veins, and muscles to your arm.
Yes.
Yes!
If you don't have your own hand, there's the potential of a donor hand or a cadaveric hand. As long as everything is still relatively intact and you can reperfuse it, then yes, that is a great potential and amazing.
The man fell onto an air hose, and the nozzle pierced his butt. It pumped air into his body at 100 psi.
Whoa.
In minutes, the man swelled to twice
Get it out of there.
size.
We see injuries like this relating to power washers or paint sprays get underneath the tissue and you get subcutaneous air. The one time I ever tell you, don't pull it out, this time you want to pull that darn thing out and get it out of there.
The air had filled his abdomen, chest, and even his face. Paramedics tried to treat him, but the pressure pushed the IV out of his skin.
Wow. You worry about air in the body when it comes to your blood vessels because you don't want the air to get into different areas like your brain, which can cause an air embolism, or within your heart itself, where then you're actually not pumping the right amount of blood or it's blocking blood flow.
The man deflated back to normal after 3 days and ended up living.
That image of him farting it out, unlikely. The body will work on reabsorbing it and getting it out of the body.
If you touch a cactus, you'll probably get the spines stuck in your skin. And if you try to pull them out, you can actually break them off in your flesh. So fragile.
Thought-provoking scenarios like these keep your mind racing at night. That's where Do Not Disturb comes into play to calm your brain so that way you can finally get some real rest you deserve. Check it out at lifehappens.com or on Amazon.
You should apply a layer of glue over the area. Once it is dried, quickly peel it off in a smooth motion. This will pull out the spines evenly, causing them to stay intact.
You can use this for a technique of splinters. So splinters are really small. These are big splinters. If they're flat, you can use duct tape. Tweezers, you're trying to pull them out and you're putting a lot of force in one area, which increases the risk of breaking.
This powerful organ beats about 100,000 times every day and pushes about 1.5 gallons of blood through your body each minute.
The heart squeezes a ton. And actually, it's interesting. It doesn't squeeze to empty. There's something called an ejection fraction. 55% is squeezed out. When it's too much, you don't want to squeeze all the blood out of there, and then too little, we don't like that. That's bad as well. You want to be right in the middle. If you enjoyed this, definitely check out this playlist right here. Binge watch everything. And as always, do me a favor, subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.